Hello guys, welcome to my channel. In this video we are going to see about the appendicular orifice, then the blood supply of the appendix, nerve supply and lymphatic drainage of the appendix. First, coming to the appendicular orifice. Actually, the appendicular orifice is situated on the posteromedial wall. See, this is the appendicular orifice. It is situated on the posteromedial wall of the cecum. And also it is present just 2 centimeters below the ileocecal orifice. This appendicular orifice, it is actually guarded by a mucous membrane and it is called as valve of Gerlach. This is all about the position of the appendicular orifice with respect to the ileocecal orifice. Now coming to the position of appendicular orifice with respect to the planes passing through the abdomen. As I said in the previous video, totally 4 planes passes through the abdomen. One is the right lateral plane, then is the left lateral plane, and the other one is the transpyloric plane, and the other one is the transtubercular plane. Now coming to the position of the appendicular orifice with respect to the planes passing through the abdomen. Actually, this appendicular orifice, it is situated 2 centimeters below the junction of transtubercular plane with that of the right lateral plane. See, the appendicular orifice is situated 2 centimeters below the junction of transtubercular plane and the right lateral plane. So it is situated somewhere here. Once again, let me revise the position of the appendicular orifice. So it is situated on the posteromedial aspect of the cecum, just 2 centimeters below the ileocecal orifice, and it is girded by a fold of mucous membrane, and the valve is called as valve of Gerlach. Then with respect to the planes passing through the abdomen, it is situated 2 centimeters below the junction of transtubercular and right lateral planes. Coming to one important clinical condition, that is the site of maximum tenderness of appendicitis. The site of maximum tenderness of appendicitis is called as the McBurney's point. Let us now see the location of the McBurney's point. This McBurney's point, it is located at the junction of lateral 1/3 and medial 2/3 of the line joining the anterior superior iliac spine, and that too on the right side, to that of the umbilicus. So once again I am repeating, this McBurney's point is actually located at the junction of lateral 1/3 and medial 2/3 of the line joining the anterior superior iliac spine of the right side with that of the umbilicus. Once again I am repeating, so the McBurney's point is the site of maximum tenderness of appendicitis, and it lies at the junction of lateral 1/3 and medial 2/3 of the line joining the anterior superior iliac spine of the right side to that of the umbilicus. Then coming to the next topic, that is the lumen of the appendix. Actually, as I mentioned in the previous video, the lumen of appendix in children, it is somewhat broader than that of in adults. After the post midlife, this lumen actually gets obliterated and it becomes much narrower. Once again I am repeating, the lumen of the appendix is quite small and partially or completely obliterated after mid-adult life, that is post mid-adult life. Then coming to the peritoneal relations. Actually, this was discussed in the previous video on the peritoneum. If you want to watch the video, please do check the description box for the link. So the peritoneum suspending the appendix, it is called as the mesoappendix, and it is triangular in shape. This mesoappendix, it is triangular in shape. Actually, this fold passes behind the ilium. It passes behind the ilium and it is attached to the left layer of the mesentery. Mesentery is nothing but the peritoneum suspending the small intestine. Once again I am repeating the course of the mesoappendix. So this mesoappendix, it is triangular fold and it is attached to the left layer of mesentery after passing behind the ilium. Coming to the next topic, that is the blood supply of the appendix. Now just consider this as the abdominal aorta, and this is the anterior surface of the abdominal aorta, right? From the abdominal aorta arises the superior mesenteric artery, right, from the anterior surface of the abdominal aorta. And again, from the superior mesenteric artery arises another branch called the ileocholic artery. That is the branch arising from the superior mesenteric artery supplying both ileum as well as the colon. See, once again I am repeating, this is the abdominal aorta. From its anterior surface arises another branch called the superior mesenteric artery. From the superior mesenteric artery arises another branch called the ileocholic artery, and by its name itself it is understood that it supplies ileum as well as the colon. So from the lower division of the ileocholic artery arises a branch called the appendicular artery. This appendicular artery actually passes behind the ileum. So the appendicular artery, after rising from the ileocholic artery, it passes behind the ileum and it reaches the mesoappendix. So it travels through the mesoappendix behind the ileum and it reaches the terminal portion of the appendix. Actually, this ileocholic artery, it gives another branch called the anterior cecal artery for the anterior surface of the ceca and the posterior cecal artery for the posterior surface of the ceca. It also actually passes behind the ileum and reaches the posterior surface of the ceca. This appendicular artery in turn gives a recurrent branch which in turn anastomoses with the posterior cecal artery. So see, once again I am repeating, this ileocholic artery in turn gives two branches. One is the anterior cecal artery for the anterior surface of the cecum and posterior cecal artery for the posterior surface of the cecum. This appendicular artery in turn gives another branch called the recurrent branch which anastomoses with the posterior cecal artery. See, once again I am repeating, from the abdominal aorta, that too from the anterior surface of the abdominal aorta arises the superior mesenteric artery. From that arises the ileocholic artery which supplies ileum as well as the colon. So from the ileocholic artery, and that too from the lower division of the ileocholic artery arises appendicular artery. It passes behind the ileum and through the mesoappendix. It reaches the terminal portion or the tip of the appendix and supplies the appendix. This appendicular artery in turn gives a recurrent branch which anastomoses with the posterior cecal artery from the ileocholic artery. This ileocholic artery actually in turn gives two branches called the anterior cecal artery and posterior cecal artery for the anterior and posterior surfaces of the cecum respectively. Now coming to the venous drainage of the appendix. So the blood from the appendix is drained by three main veins, namely the appendicular vein, ileocholic vein and superior mesenteric vein that finally drains into the portal vein. Now coming to the nerve supply of the appendix. Appendix is actually innervated by both sympathetic and parasympathetic nerves. Sympathetic nerves are actually derived from the T9 and T10 segments through the celiac plexus, and the parasympathetic nerves, they are derived from the vagus nerve. So the referred pain of the appendix is actually felt at the umbilicus as that of the pain in small intestine and testis. Now coming to the lymphatic drainage of the appendix. Of course, it is much easier topic. So the lymph from the appendix, it actually passes to the ileocholic lymph nodes situated in and around the ileum and colon, or it may indirectly drain into the lymph nodes situated in the mesoappendix. Once again I am repeating. So the lymph directly may pass to the ileocholic lymph nodes or it may indirectly reach the lymph nodes situated in the mesoappendix.